Hi, I'm Keem, ultra endurance runner. Here with Dr. Pennell. We're going to be talking about some common injuries with runners as we're coming up on National Runners Month in May. So we're just talking about some of my recent injuries. Had a pretty swollen ankle, feet, and coming up my foot. A little bit of knee issues. Took my knee a little bit, but we were talking about how you see a lot of issues up the chain as well, and I'll just let you continue going to that, talking about how, if it's in the knee, usually you look before, or look above that, below that.
So Akeem's question was, what are some of the common injuries that we see for runners in general? So I told him that there are a couple different things we look at. We see everything from hip and low back to knee to foot and ankle. They may be something that, an issue that's bothering them individually, or it may be something that is actually part of a bigger grouping. So we may see the individual pieces, or we may see a combination of knee and foot and ankle, or knee and hip, or all three essentially. So regardless of where the injury is coming from or what they present with, we look above and below that joint to see what's going on and how everything is moving. May look at the hip and SI joint, lumbar spine.
Yep.
Look into hip flexors, low back. What does our glute activation look like? We see a lot of lower cross syndrome where we have hip flexors and lumbar spine erectors are tight and tense, and then we don't have enough activation from our core and from our glutes, and you'll see a lot of tight hamstrings and things like that due to that positioning. So then you come down into the knee, and a lot more of the knee issues could be something strictly with the knee. Now, if there is a meniscus tear, if there's ACL, PCL injury, those are something a little different. We may see tension from other muscles that surround it, but a lot of times we see hamstring tension, we see quad and patellar tendon tightness, we see IT band. A lot of people have IT band issues, especially runners and people that are in the gym quite a bit.
Yep.
Depending on your form, depending on the shoes that you wear or don't wear. Right? And then exactly. And then we just work down as well, where we may see calf issues, posterior tibialis or anterior tibialis. We get into the foot and ankle, and we look at how's the subtalar joint moving. Do they have plantar fasciitis? Does that tie into the Achilles tendon? Right, there are a lot of different pieces in play.
Yep.
And so you got to really lay out all the information, look at the history, and then see how you want to